Interstitial Pulmonary Disorder, or also known as interstitial lung disease. In this video, you will learn the different types of lung diseases, specifically the occupational lung disease, which is a work-related disease, and sarcoidosis. This involves the definition, the risk factors, the clinical manifestation and management, diagnostic procedures, nursing intervention, assessment, and prognosis of the disease. So what is interstitial lung disease? So these are the terms used for a large group of diseases that can cause scarring or fibrosis of the lungs. In the lungs, specifically in the interstitial space which has consist of the walls of the air sacs of the lungs known as alveoli and the spaces around the blood vessels and small airways are the common target of this disease. The scarring causes stiffness in the lungs, which makes it difficult to breathe and get oxygen to the bloodstream. Occupational lung disease or pneumoconuses, specifically silicosis, asbestosis, and cause worker pneumoconuses. So what is occupational lung disease or pneumoconuses? It is a disease of the lungs occur in the numerous occupations as a result of exposure to organic and inorganic such as minerals, dust, and noxious gases, fumes, and aerosol. So let us discuss the different types of occupational lung disease. Silicosis is a chronic fibrotic pulmonary disease caused by inhalation of silica dust, such as crystalline silicon dioxide particles. Exposure to silica and silicates occurs in almost mining, quarrying, and tunneling operation. These are the symptoms that will be manifested by the patient who are diagnosed with silicosis: cough, shortness of breath, fatigue, weight loss, chest pain, fever, peripheral edema, and cyanosis. Asbestosis. Asbestosis is a disease characterized by diffuse pulmonary fibrosis from the inhalation of asbestos dust. The picture shows 9/11 World Trade Center attack that had killed thousands of people and affect the health of thousands of more due to the exposure of asbestos dust from the building, usually caused by exposure of numerous occupations including asbestos mining and manufacturing, shipbuilding, demolition of structures containing asbestos, and roofing. These are the clinical manifestations of asbestos disease: mild to moderate chest pain, dyspnea, persistent dry cough, anorexia, weight loss, malaise, and claving of fingers. Call workers pneumoconuses. What is call workers pneumoconuses? It is also known as the black lung disease. This includes a variety of respiratory diseases found in coal workers who have inhaled coal dust over the years. As you can see in the picture, the alveoli, which has a large air cavity lined, has a presence of dark coal particles which causes inflammation, decreased gas exchange, and scarring. Phatogenesis. Several particles of silica, coal, and asbestosis reach the alveolar epithelial surface, induce lung injury, and apoptosis stimulate alveolar macrophage, epithelial cells, and fibroblasts to release several factors of cytokines attracting and stimulating leukocytes such as neutrophil and lymphocytes into the lungs. The activated alveolar macrophage and neutrophils produce a burden of oxidants that induce apoptosis and injure the alveolar wall. The response results in granulomas formation due to the release of cytokines and other substances that promote replications of fibroblasts. Clinical manifestations of coal workers pneumoconuses are chronic cough, sputum production, dyspnea, and cough up large amount of sputum with varying amounts of black fluid or melanoptosis. These are the overall diagnostic procedures of occupational lung disease or pneumoconuses: chest X-ray findings and history of exposure, pulmonary function test, test for tuberculosis, and CT scan of the chest. Medical management of pneumoconuses. There is no effective treatment for pneumoconuses as the lung damage is permanent and often progressive. Management is directed at controlling infection and treating the lung disease. Oxygen therapy may help improve the activity tolerance, and the patient must be instructed to avoid additional exposure to asbestos and to stop smoking. Nursing management. Nurses need to make every effort to promote measures to reduce the exposure of workers to industrial products. Advise the use of protective devices such as face masks, hoods, and industrial respirators to minimize the exposure and screening or monitoring of individuals at risk. Treatment plan. Pneumoconuses can be cured. Once the disease has been diagnosed, treatment is aimed at keeping it from getting worse and controlling the symptoms. A treatment plan may include not smoking, staying away from all dust exposure, using oxygen, and taking medicines called bronchodilators that open lung passages. These are the possible complications of pneumoconuses: progressive respiratory failure, lung cancer, tuberculosis, and heart failure caused by pressure inside the lungs. Nursing diagnosis. Ineffective airway clearance related to the increased production of secretions or thick secretions. Imbalanced nutrition less than body requirements related to loss of appetite and nausea and vomiting. Risk for infection related to chronic disease process. Impaired gas exchange related to airway obstruction, and risk for fluid volume deficit related to fever, sweating, and vomiting. Another type of interstitial pulmonary disorder is sarcoidosis. Sarcoidosis. It is a multi-system granulomatous disease of unknown etiology. It may involve almost any organ or tissue but most commonly involve the lungs, lymph nodes, liver, spleen, central nervous system, skin, eyes, finger, and parotid glands. Pathophysiology. Sarcoidosis started from exposure to bacteria, fungi, virus, chemicals, or acquired predisposition to the disorder. The hypersensitivity response results in granuloma formation due to the release of cytokines and other substances that promote replications of fibroblasts. In the lung, granuloma infiltration and fibrosis may occur, resulting in low lung compliance, impaired diffusing capacity, and reduced lung volumes. These are the signs and symptoms of sarcoidosis: night sweats, lightheadedness and heart issues, shortness of breath, weight loss, painful nodules under the skin, fever, redness, pain and dryness of the eyes or changes of vision, enlarged lymph nodes, enlarged spleen and liver, and fatigue. Diagnostic procedure. Chest X-ray and CT scan. These are used to assess pulmonary adenopathy and presence of nodular lesions in the lungs. Next, mediastinoscopy or transbronchial biopsy, in which a tissue specimen is obtained through the bronchial wall. Pulmonary function test. Results are abnormal if there is restriction of the lungs' function. Arterial blood gas measurements may be normal or may show reduced oxygen level or hypoxemia and increased carbon dioxide levels or hypercapnia. Nursing diagnosis. Impaired gas exchange related to altered alveolar capillary membrane changes and decreased oxygen carrying ability as evidenced by fatigue, dyspnea, diminished breath sounds, or cough. Nursing intervention. These are anxiety reduction, airway management, oxygen therapy, respiratory management, energy management, respiratory monitoring, and ventilation assistance to the patient. Prognosis. Interstitial lung disease can vary from person to person and depending on what causes it. Sometimes it progresses slowly, in other cases it worsens quickly. Some interstitial lung disease have a better prognosis than the others. The average survival for this type of disease is currently 3 to 5 years. It can be longer with certain medication and depending on its course. People with other types of interstitial lung disease such as sarcoidosis can live much longer. Thank you so much for listening. I hope you learned from this video, and if you have any clarification and concern, please message me. Thank you.